What's going on, everybody? Welcome back to another episode of the Muscle Memoirs Podcast. Today, we are joined once again by our good buddies, Artem and Melly. Thanks for being here, guys. It's great to see you. And as always, across from me, well, not really, but through the computer, Mike Murray. How you doing today, Mike?
I'm doing fantastic, Cole. How are you?
Wonderful as always, man. Wonderful as always. So today, we have the opportunity to get Artem and Melly here with us to kind of present a roundtable discussion, if you will, on just a couple of topics. Probably going to be a shorter episode, but hopefully we can get some good content out of it. Mike, if you want to start us off, just going right into the first topic, that'd be great.
All right.
Man.
So as far as our first general topic of discussion, we're going to talk about manual therapy modalities. Just as a quick background, Artem, why don't you tell us about some examples of manual therapy modalities and basically the science behind them? Do they work, man? You are the doctor here.
Manual therapy sucks. Is that all you need to know? No, just kidding. So I believe you're referring to just joint mobilization, soft tissue release, that kind of stuff. Are you throwing in electric stimulation in the mix there too, or it's a modality,
that's
not
for you to make
necessarily
that
a manual
decision.
technique?
Yeah, I think that's for you to make that call. It's definitely
Okay.
not the one that jumps out, but if
Okay.
you think it fits in that box, put it in there.
We'll keep it to what you physically do to yourself or someone else.
Okay.
So that would be a soft tissue release, whether it be with your hands or with a tool, or with a Theragun, hyper ice type deal. Massage would fit into those. Joint mobilization that they teach physical therapists and athletic trainers. And then I guess if you guys want to talk about foam rolling and self myofascial release, those kinds of things. Now, do they work? That's kind of the big question, isn't it? I think
That's why I asked.
Oh, thanks, Sid. Thanks, Sid. I think based on the research, there isn't really a good explanation for how they work, but from experience and having done to myself and having done to others, I definitely do believe that there is a place for it. But the big overarching theme in the literature as far as how it works is this broad word of neurophysiological effects. I don't know if you guys have ever heard that kind of explanation for it. There's not necessarily a structural component. You're not actually changing structure. You're not breaking up scar tissue or whatever the people say that happens. You're not repositioning joints. What you are doing is influencing the nervous system and the brain. Okay, you're applying some kind of sensation, and the brain reacts in a way that helps you relax or blocks the signal of pain, basically.
So just to hop in real quick to put it in really layman's
please
terms.
don't interrupt me.
Too late. So I just actually had this conversation yesterday. It's the best way to put it for the regular folk is you got punched in the a dead leg or something like that, and then what's your reaction? You rub it, or if you get punched in one area and punched in the other one, your brain kind of tunes out one of them and goes to the other. You know what I'm saying?
Yeah.
So your brain has a hard time getting two different little responses in terms of the pain response there. So it just goes to the other. So I think that's what he's kind of getting to in terms of this effect.
Yeah. So you have a pain signal going from the brain. You apply different stimulus to basically interrupt that signal and give it another thing to process. That's essentially kind of how it works, or at least the most basic understanding of how it works. And they don't truly understand all the different components of it because there are so many. But as far as from my experience, there is a time and place for it. I know one of the components of your question was the placebo effect. in regards to that, right? Which
Yes.
is, as far as the placebo effect, it's always in effect with everything that, as a physical therapist that I do, just based on my explanations of how things work, the things that I apply with the patient, there's always going to be some sort of placebo effect. And really, you'd want to play that up as much as you can because that'll make for a more effective treatment, right? So really, saying that there is a placebo effect in manual therapy is not necessarily a bad thing. It just is. What were you going to say, Mike?
Correct me if I'm wrong, but I do believe there are some studies about manual therapy and basically like a sham treatment compared to like something specific, right? And just like basically the fact that a physical therapist is putting their hands on a patient, regardless if they're actually trying to get anything done, like will produce a positive effect just because the person expects something good to happen from a PT putting their hands on them.
Absolutely. Manual therapy is very non-specific. So like when we talk about all these like different modalities, they're really all the same. Like it's just different stimuli, but really the effect is all the same. And how much you hype it up and just like the aura around it, the patient's the person's expectations for it, the context that they're in is gonna affect the treatment. So like if you were going to go to some guy that was like well known as like this expert manual therapist, you're going to have a much better result than going to some guy that like, just this is his first day doing it. They could be doing the exact same thing, but just that context and those expectations are going to set the bar for how your body perceives it.
So based on that, would you say that, so if we take this box of modalities and we have foam rollers, we have a Theragun, we have massage, maybe acupuncture. These are all kind of similar, and theoretically, one's not better than the other because they have the same effect, right? But could you say that massage is likely better than a foam roller because instead of you doing it to yourself, you are placing your trust in this professional, and just because of that, there might be a better response?
Could be, but also the fact that you can actually relax and like let someone do that to you, as opposed to like there's actually like you're still working while you're like rolling on a foam roller, right? You're never like truly relaxing, and the idea of like honestly, it just feels good for like somebody else to touch you, right? Like there's an effect in that too. You have something to say, Mel?
Just, but in like, that was a funny line. But just to play devil advocate there, like it could also have the opposite effect though. Like a lot of people have tough time like relaxing because someone else is touching them.
Sure.
Because of that situation, right? So like, especially if like, say like a female is like massaging a male or vice versa or whatever, and in any situation like that, a lot of people have tough time truly relaxing on that. And then you also get to the point where like the money comes into play. So like there's expectations, and like atmosphere comes into play with that too. It's just like a really I mean it's like
it's a
like
big
anything of this is like it's very individualized, right? So everything is different for everyone. So like that's why like these modalities and stuff, they might all have the same effect in terms of what comes from it, but like somebody might be hyping up like a foam roller but hate using like a lacrosse ball, like, or something like that, or like an AccuMobility ball, or like one of the rollers, like the stick rollers or something like that, just because of how it plays to that individual. You know what I'm saying? So I think it comes down to literally just like whatever is best for that person in their mind.
Sorry. Now, Artem,
it's all going to be context driven. Right. Sorry, Cole, go ahead.
How would you go about managing a patient that finds, I guess, great success in your manual therapy modalities, and maybe they turn to start relying heavily on them for feeling good or getting those positive benefits out of it, and so they'll come to you and they only want a massage or something? How would you deal or manage that kind of situation?
Well, it first comes down to managing like expectations from the very beginning, as far as like what to expect from my line of care. Like what do I think would best benefit them? And from my experience, generally having that conversation with people, like especially the people that I see who have gone through like several rounds of physical therapy at different places and have failed, and it happens to be that a lot of those physical therapy treatments centered around like manual therapy. So they've already like been through that, and we just have a conversation like, hey, I know like it feels good, but think about the fact that like, why are you here? Because it didn't really truly get you to where you want to be, right?
Mhm.
And then sometimes maybe you just use it to your advantage. Like, hey, you think manual therapy is really effective for you, works really well. Well, let's do a little bit of manual therapy, and then that'll give us a window to do some pain-free exercise that I think will get you to a permanent result as opposed to this temporary feel-good thing.
Right.
So bouncing
sense.
off of that, we have some sort of positive effect going on. We don't know for sure what that is, but we kind of know what it's not, and it's not breaking up scar tissue or adhesions. But considering this effect, is this purely temporary, or are we looking at through habitual use of these things some long-term changes leading to increased range of motion? What's the application here?
I don't have a great answer for you there. Maybe. I don't think there's like a ton of research on like a long-term manual because I mean, define long-term. I don't really know. Is that months? Is that years? Who knows? From my experience, it's a short-term gain that, say like a gain in range of motion. Then you get up off the table, you start moving the way that your body's used to moving, go back to your movement habits, and then we measure again, and you're back to where you were before. That's kind of what I've seen.
Mel, do you use manual therapy with your athletes? Is this something that you tell them to do, or is it something that you're just kind of like, hey, if you're into this, you can do this? Where do you use it? When do you use it in your training sessions?
Yeah, for sure. I mean, I definitely, it's part of like the warm up to the workout, to the training. But so my thing is like, you can use the modality of your choice. Some people like the foam roller, some people like the lacrosse ball, some people really like the hyperized Theragun type thing. Um, but my goal is to kind of not let them go crazy with it, right? So like I don't want them spending 15 minutes foam rolling like constantly, nonstop, I think it's viable and I think it's important so that we can get that temporary range of motion increase and stuff like that, and you feel good, so you're primed. Like Artem was saying earlier, it's not like a physiological thing. It's more of like a neurological thing. It's part of their readiness. Part of their readiness for the training. So like, yes, their body's going to feel good, but also their brain, that placebo effect is going to kick in regardless. Be like, okay, that's part of my routine. Like I'm ready. So like their brain, their central nervous system is part of that. Like, all right, it's that prepping. So I think that's important. I don't want them to get like crazy with it to go forever and just like kind of ruin the whole point of it. And it's not the only thing we do in terms of the warm up. Like a lot of times with my younger guys, I'll have like a spike ball thing, right? Get the body temperature up because that's super important too in terms of range of motion increase and stuff like that. Getting that body temperature up, and then like a dynamic thing. I mean, obviously super important. Put them through a dynamic warm up to prep them for whatever activity they're going to do during the training period. But there's definitely a time and place for it in every training session for sure.
Do you ever use this post-workout as a means of potentially facilitating recovery, or do you think its application is purely in the warm-up just to get you ready mentally and physically for your training?
I mean, some people like to use the hyper ice gun or the Theragun, whatever. And so it goes back to kind of your point, though, for me, like the dependency that people have, like, oh, after a tough work, oh man, my legs are shot. Like, Like I need the gun, or like I need the roll. And so like that's cool and all. Like I get it. But I don't want people starting to depend on that, especially like in the off season period, when we're trying to drive an adaptation of, stress. We're trying to put a little bit more stress on the athlete than we would normally. And like the immediate recovery is not like as necessary as it would be for an athlete in season, where they have to bounce back a lot quicker. So like I try to stay away from that kind of stuff in season, or like out of season, like the post-workout, like Theragun treatment and stuff. But like Artem was saying before, it's not like we don't know if it's like a long-term effect thing. We don't have enough studies, we don't have enough research, we don't have enough like true definition of these things to get like a long-term outlook on it. So is it the worst thing if they hop on a foam roller afterwards? I don't think so. I don't think it's going to be the end of the world. So I have no problem with it, but most of the time it's a pre-workout type deal.
You mentioned kind of part of your specific world with a lot of the athletes, and I think this segues quite nicely into the second part of this discussion. So Cole, you want to take us there?
Yeah, so in talking about the idea of injury prevention and if we can prevent injuries, we hear a lot of times, and recently for me specifically, I got injured because I lack flexibility, or I have a tight hamstring or something of that nature. People come to this belief that because they can't touch their toes, as an example, that they're going to be more likely to get injured. Is it because of this lack of flexibility, or is it really a matter of poor movement quality in the context of what they're trying to do, or is it lack of strength of the musculature surrounding these specific structures that are likely to be injured? Mel or Artem can feel free to chime in.
Artem, you want this one first?
Sure.
All right, I'll piggyback.
All right, cool. First of all, I think the whole concept of like injury prevention, like right off the bat, just like doesn't really make sense, because there's just so many variables that like within the injury realm, like there's so many things that can go wrong that can cause an injury, like during like any sports game, like another player falling on top of you. You can't really prevent that. Right. So you can't. So the idea of injury prevention isn't necessarily a thing, but there is the idea of reducing injury risk.
Reduction, yeah.
So reducing risk, not necessarily preventing injuries. Because there are certain things, like you mentioned before, like that could be a factor in causing an injury, like decreased mobility, whatever it may be. Even programming things like your volume, like if you've heard like the acute to chronic workload ratios and things like that, like those could present a risk factor for injury that then you can manage and reduce the risk of. Does that make sense?
Mm-hmm.
Mel, you have anything to follow up on that?
Injury prevention is like, it's a farce, like impossible. We could, like you said, reduce the risk. We could, like, no matter what the training modality we do in here, we can never truly replicate game speed, right? Mm-hmm. Like sports happen way faster than what we can do in the gym, right? So like there's so many different things in the sense of a game, like contact injuries. We can't prevent that. Like we can't prevent a dude getting smashed last night in a football game and separating a shoulder or breaking a bone. We can't prevent that. We can do our best to make sure that athlete is strong enough and resilient enough to be able to withstand certain positions and stuff like that. But we can't just prevent injury. It's bound to happen. The sports are so violent, and I'm not even saying just contact sports. Baseball is a violent sport. Like the throwing motion is so violent, there's just too many things, like sleep. Like did the dude has he not been sleeping well? And like studies show, like if you're not getting a certain amount of hours of sleep to aid recovery, your injury risk goes crazy high. And so there's things that like Artem and I can't prevent. Like, we can't prevent a kid or an athlete from getting 4 hours of sleep. You know, we can't prevent a guy from eating like a 13-year-old kid normally eats. There's things that are just out of our hands that we can't control. So like I'm definitely on board with Artem's like reduction in risk as opposed to prevention for sure.
Well, Steve, I know that you do, for example, I think you mentioned in the first podcast we did that you're not going to just go in with a 13-year-old kid and stick a barbell on his back and have him do squats if he can't perform the movement well and efficiently and safely, most importantly. So you find other ways to like teach that movement first and kind of reduce the risk of potential injury in the future instead of just jumping balls deep, if you will. You know what I mean? So
for sure. Oh, keeping it G-rated, please.
So in terms of reducing risk, then, what is the value of stretching and strength? I think a lot of people, it's still prevalent in the strength and conditioning field. There's this, this value of stretching, and that static stretching increases your range of motion, and having more range of motion is crucial to preventing injury during a game. Isn't that like Tom Brady's whole thing? You got to be like elastic and like not all bunched up and tight.
Pliable.
And that's you got to be pliable.
Pliable is pliability. That is what the term is.
If you look at the warm up routine for like high school and even college sports, like there's usually a good chunk of static stretching in there. So talk about the value of stretching, and is it more important or less important than developing strength? Let's dive into these two.
So real quick before we get into that, before I let Artem go into that, because he's already chomping at the bit with like the microphone. Like the flexibility and all that, like the mobility, these are like such buzzwordy catchphrase. Like, oh, it's such a hot topic. Like, there is such thing as too much flexibility. Like that's what, like it is so dependent on the person. So like, that's what I want to preface this whole thing by saying is like, I think we've come to the point where like, we realize that, hey, not everybody is built the same. Not everybody's skeleton is the same as the other person's. So it's very case dependent, right? It's dependent on the person that's in front of you that you're training or that you're seeing in the clinic. So like the routine for Tommy is going to be different than Johnny, right? Because this kid might have I got it. I don't know, dude. I don't know, but like they're just two different things. So like like in whatever case, range of motion needs to be controlled. All right, they need to own that range of motion. They need to have the strength in those positions. So it's super case dependent. So now I'll let Artem just go buck wild on this.
Yeah, Melly, you're absolutely right. So again, it comes back to
write this day down.
It's all context dependent. Like, how much flexibility do you need for what activity? Like, do you have enough? Do you need more? It all depends on, like Mel said, the individual and what they're trying to accomplish. There's a possibility that you have too much flexibility, too much range of motion, and lack of control. That is also a bad thing. Or you don't have enough range of motion, you don't have enough quote unquote flexibility to accomplish the task at hand. Again, also a bad thing. As far as like flexibility or stretching being more important than strength, again, I mean, I guess to address the whole stretching thing, I don't find much value in it because it's not really addressing the true issue at hand. Because for instance, you think of you're stretching a tight muscle, without actually, quote unquote tight, without actually addressing, why is it tight? Like, okay, like you're stretching, which by the way, again, is a temporary change in muscle length. And even I shouldn't even say muscle length. It's I think in the research, it's tolerance to stretch that is really the factor that changes. So you're never actually changing muscle length, which is the goal of static stretching. So to me, it's kind of useless. it's one of those like kind of feel good things. If it feels good to you, do it, but just know that you're not actually doing much. Right. And then coming back to the whole point of, if there's a true need for more flexibility, first identify why, like what the reason for that muscle tightness is. Like, why would a single muscle in your body just get tight for no reason? There's going to be most likely what I'm getting to is like joint position. Joint position will dictate the length of the muscle, right? Whether it's in the shortened or lengthened position. If you're not going to address that, then stretching all day isn't going to do anything. Does that make sense?
The classic ones, like the tight hamstring,
right?
The tight hamstring is usually not tight. It's usually overstretched because of the joint positioning, right?
Right. So, and the whole like tightness thing, tightness is a sensation. It's nothing more than just if something feels tight, all it is a sensation. Like I've had, can't tell you how many people say, oh, I have tight hamstrings. And then you put them on the table and they have a 90-degree straight leg raise, which is completely normal, or beyond.
Right.
You know, you can feel that tight, like sensation of tightness, whether a muscle is shortened or whether a muscle is lengthened over its like resting length.
Right. Overstretched.
Right. So it literally doesn't tell you anything.
Yeah, that's like oh man, they told me I have to stretch my hamstrings because they're tight. Well, dude, actually, it's
exactly
probably that, like that tightness feeling, like you said, can be used in so many different contexts.
Right.
But
Artem,
the problem is like the coach or whatever is just gonna be like, oh, go stretch your hamstrings, when that's not really doing anything.
Right.
And like going off of that, so Artem, say you have a client or a patient that comes in and they have an injury, say a hamstring injury, and they play football, and their whole life is getting hammered into them. Oh, stretch your hamstring, stretch your hamstring, stretch your hamstring. Do you find it you have difficulty communicating and educating the patient to kind of overcome this mindset that's been bestowed upon them for such a long time?
I wouldn't say necessarily difficult, but it just takes time. Me just telling them, hey, like your hamstring's not tight, this is actually normal, one time isn't going to do anything for them. It's a process. Like the education doesn't stop like after the first sessions. Throughout their whole plan of care, like they'll see the changes in their body. It'll create some buy-in, and they'll build some trust with me, so that the things that I tell them hold more value. But I wouldn't necessarily say it's difficult. Some people might hold on to those thoughts more than others, just because, they've lived 40, 50 years and they've been told the same thing. So, and then sometimes
in the like youth athletes though, it's tough because they get it from coaches, right? They get it from superiors and people that they like automatically are told to trust and like you said, buy-in. Since they're the coach, they're automatically like, oh man, this dude knows what he's talking about, right? And so like that gets tough because kids latch onto that and they're like, well, yeah, but my coach says this. But like Artem said, like the light bulb goes off a little bit when you say something, you explain it, and you reach their level with the explanation, and then they start seeing a change, or they start seeing a value in what you're saying. So like 100%, it might not be difficult, but it's a process, right? So like Artem said, he's not just teaching on the first day and then just having them do the next whatever, how long they're there in the clinic. It's hey, every single time you see that person, you educate. You like let them in, like you teach them something, or you show them something of value so that they can learn themselves. That's like, regardless of the position you have, like whether you're a PT or a strength coach, you're still trying to educate, right? So, because that's what's the ultimate buy-in. When things start clicking for them and they see the value, the positive value that it brings, that's going to be the buy-in. And you want to leave them more educated than when they came in. That's your ultimate job, because you don't want to really see them again. If in Artem's case, you know what I'm saying, right, Artem? You want to be able to send that person off with the ability to like
manage themselves
instead of
Yeah.
like having to rely on you.
Yeah, absolutely. And as far as like the education piece, like you said that like creating change or showing them value or more value in something is absolutely going to be like the biggest factor that you can play up to.
For sure.
And it's always not necessary to completely change someone's viewpoint.
Yeah.
It really isn't. If they feel that their hamstrings are tight, they need to stretch. Maybe you just show them an alternative. Like, hey, I get it, you love stretching, but let me show you something better. And then
Yeah.
you have them do it, whatever it is, and have them like feel the difference. Be like, hey, instead of stretching, why don't you try this out for a while?
Right.
Okay, I'm not gonna sit there and explain to them that stretching doesn't work or this or that. Just show them something different. Explain to them why this, why don't you play around with this for a while, and they actually do feel a difference right away, and they'll be more likely to follow through, and you don't have to sit there and give them a whole lecture on muscle tightness.
Right.
So if static stretching isn't going to be doing much for these people, then where should we be prioritizing our time? Should we be looking at their available range of motion and getting them stronger through the range that they possess, just get them better at controlling that? Or are there other things we can do to increase limited ranges of motion? Does that make sense, what I'm trying to get at with that?
Yeah. Well, I guess it depends on, do they have enough range of motion to accomplish the task that they need to accomplish?
Depends on the
Right?
population. Right?
Yeah, it depends on the context there, because if they don't, maybe there needs to be some time spent on regaining some lost range of motion so that they can then learn to control that range of motion and then be able to accomplish whatever task they want to accomplish, right?
Yeah. So for
Yeah,
example, just to make this an example, is like baseball guys, right? So that's the population I see most. As soon as they come off their season, a long like 8-month season, they're gonna see a reduction usually in hip IR in their front hip and say the swing. So a right-handed guy, their left hip is going to have a reduction in internal rotation, and their throwing arm is going to have the same thing, a limited IR. And so you want to spend the first couple weeks kind of trying to regain that so that we can strengthen within the proper ranges of motion. You know what I'm saying? So like even for like certain populations, there's times when you need to regain that range of motion, and then there's times where you need to strengthen that newfound range of motion. You know what I'm saying?
So
You know what I'm saying?
how do we go about
Thanks.
regaining or strengthening then?
Go ahead, Artem.
As far as regaining that like passive range, let's say like on the table, that's going to be a matter of like restoring joint position, and that's kind of what we discussed like a little bit last time, right? You have these like joint range of motion norms under normal circumstances, like, right, your hip should move through this amount of range of motion, your shoulder should move through this amount of motion. When you change joint position, you can see changes in that range of motion, right? Because all that range of motion is reflecting is the position of the joint. You guys follow?
Mm-hmm. Yes,
so,
Artem.
like, okay. Say like take like a like pelvic position, for instance. You take a pelvis and you like anteriorly orient it, like a classic like anterior tilt that you see like pictures of on Instagram. Okay, let's say when you anteriorly tilt a pelvis, you have like your anterior hip musculature, like your hip flexors pick up leverage, right? They're shortened. So now you have a limitation in hip extension. So I use my table test. Say I measure their hip extension, it's limited. Maybe I measure some other measures that tell me where that joint position is, right? And I work on restoring that range of motion, basically by putting them in the positions that they don't have and teaching them how to control it. Okay? That would be like the first step. And then you increase difficulty with more complex movements. Maybe we move from the table to standing, right? And then standing dynamic exercise where they have to be able to hold on to those joint positions, say like that pelvic position during a squat or during a hinge, whatever, without like grossly overextending and like dumping their pelvis forward. Does that make sense?
Yeah, so basically what you're saying is we're finding these positions that they're limited in, and then we're kind of using our training to put them in these positions, forcing them to control them, and then getting stronger through that range that was weak or restricted before.
Yep. Yeah, essentially.
All right, perfect.
I think
Mel,
people
anywhere to go
understand
off
that, like, the training goes into play a lot, right? So like Artem will tell you, like, yeah, he wants to do the table and stuff like that, but he also wants to get you out on the training floor so we can drive home that adaptation, right? That load that we're going to put on is going to help drive home that adaptation and keep driving improved control in the newfound range of motion. So like an underrated portion of this improvement in terms of ranges of motion is training. Like there's simple ways that we can program to help drive adaptation. So like a big thing that I'm kind of fighting right now, but I'm lucky to have like guys like Artem and stuff, is that, you know, a quick conversation between two people, two professionals, will help like monumentally, right? So like I have Artem run through a couple of table tests with some of my guys, especially some of the special cases that I would rather have him, because he's way better at this stuff than me. I would rather have him focus on it so that I can get the most accurate information. But then a simple conversation between the two of us, and boom, I have a program already set up that if it's done the way we have discussed, it's going to drive the adaptation that we're looking for, whether it be increased stability in a whatever buzzword you want to use, you know? So like that's where the play between, hey, these different professions like a PT and strength coach, that's like really important, because it's not as hard as like it's tough, but it's not as hard as people make it out to be, as long as there's a sharing of information and like kind of like a hand in hand, you know. Now we're lucky that we have each other to bounce ideas off of and whatever, but like it's like Artem will tell you that, like, I've talked to him many times. All right, this guy is a special case. What should I do? And he's like, all right, we want to work overhead or whatever like that. You know, we want to get like do the you know, pull over a kettlebell pullover and add in some breathing with it. Like that's just one simple case on the past like 3 or 4 months that we've done since I've opened here. It is that like just to drive the adaptation that his table test showed that we needed to drive.
And that communication between the PT and the strength coach is so important, and something that isn't always going on, right? So especially if it's not an athlete at a university where all the staff's working together.
Sure.
So I'm sure your younger athletes, Mel, like if you didn't have Artem, and you know, and they're like, oh, it's just at the physical therapist, and you know, maybe they said, well, restricted here, this and that. But if that's never communicated to the strength coach about, okay, so how do we actually develop our strength training program to fix these things?
I mean, it's tough. Like I've had kids go to outside sources, and that's fine. Like I'm never going to tell them like, hey, you have to do this, you have to do that. But I've reached out to PTs in the past and gotten no response, you know, concerning like an athlete. And also like a big thing, and Artem can talk about this because he probably sees it, but there's like, it's weird, just like in any profession, it's like two schools of thought, right? Like there's like a newer age, like progressive type PT, like which is like Artem in this case, you know, and that's the more like I vibe with. And like it's easier to go hand in hand and work together with that, because you know, I think they stay current. And they stay, and like in our fields, like it's changing a lot. We're finally, you know, like this point now and 10 years before, totally different, right? It's just like changed and grown, and we've gotten better. But then there's still like the old school PT, you know, making kids do band pull aparts, you know, for scapular reasons, like nonstop. And so like their report back to me about a kid is going to be like jaded, in my opinion. Like, am I getting the real deal here? And so like I had to take that with a grain of salt, and not like I'm gonna like just take whatever Artem says without like looking into it. but I'm a little bit more skeptical in terms of like what to take and what not to take in terms of like the report coming from certain, parties. You know what I mean?
For sure.
Yeah, just to jump in here, on Mel's point, there's always going to be dinosaurs in every field.
Right. Yeah. Exactly.
There's
And
people
I'm not
that
trying
hang
to
on
speak,
to
bad.
Yeah, no, we get it. But also to your credit, there's always like the outcome for an athlete is always going to be best when there's collaboration between professionals. But when you're really not getting valuable information from other professionals, then it really doesn't matter. You just have to depend on yourself.
Right.
Do I think that you need that physical therapist's opinion on what's restricted and what's not to make your decisions? No, I don't. Because if they have a gross lack of movement somewhere, you're probably going to use your coach's eye and you're probably going to notice it when you're coaching this athlete while they're doing their exercises.
Right.
Like it becomes pretty obvious sometimes. And then you're probably going to use your coaching logic to put them in positions either to regain that motion or to avoid, them hurting themselves because they just look like complete shit doing this exercise.
Right.
So it's like it's not always necessary to do all these table tests, have all these numbers from, a physical therapist or whoever. Like, I trust you as a coach to be able to make those decisions competently, because you put in the time, because you pay attention and you use your eyes and you use your brain. Does that make sense?
And like the feedback on that, I'm not sending every single kid in here to Artem. That's a waste of Artem's time, and I would feel terrible. I'm only sending the kids that I know, A, have an issue, B, are coming off of injury, or 3, that are like a special case. You know what I mean? Like a kid that's like really big for his age, or a kid coming off ACL reconstruction surgery, stuff like that. I'm not going to send the regular 13-year-old soccer player to like, I need to get your table test here, because in all honesty, kids at that age, they're going to come in like a blank slate. They haven't had enough either training experience or even like field experience to really mess up with like their ranges of motion and stuff. They're pretty coming in like, all right, you need strength. Most of the kids coming in are like, I can basically start with a foundational strength program because you're all arms and legs and you just need to be able to control your body and how they move. So like, I don't want to say that I'm sending everything to Artem, but like when it's like one that I really like want an extra pair of eyes on, that's when I'll send it over, because I trust him to do that. And I think, in all honesty, like more coaches need to do that on both sides of the fence, right? So like PTs need to work hand in hand, but like guys in my position, we need to do a better job of like, hey, let's send it out to this guy. Let's get the most accurate information so we don't screw this kid up. You know what I'm saying? And like, we got to check the ego at the door a little bit.
For sure. Cole, any questions coming off of this discussion?
Nothing to come to mind right now, but really good stuff, guys. Appreciate your time. Anything else from you, Mike?
That's all I got. Appreciate having you guys on. Thank you for taking the time to do this. Hopefully this becomes a consistent thing, maybe once per month or so. That sounds good to you fellas.
Sure.
Absolutely.
Sounds good, Captain.
All right, guys. Well, hopefully we'll be back with another episode soon, and there's definitely some good juicy content in this one, short but sweet. And we'll catch you on the next one. Thanks for tuning in. Have a good one, guys.
See you guys.